Welcome back. We're going to change gears and we're going to talk about Piriformis Syndrome and lower back pain and trigger point acupuncture, also known as the dry needle technique. Acupuncture has precedence with that, and we're going to show you right now. So I want to introduce you to I can't pronounce his name. How do you pronounce it, hon? Hoam? Hoam. He's a very famous Korean acupuncturist from the 16th and 17th century. He wrote, I think, many books. The Dongwe Bogum book, which is a Dongwe Bogum, which is a Korean herbal, one of the first Korean herbal manuscripts. But here, I call him the father of trigger point acupuncture. He's the father of the dry needle technique. Give props to Janet Travell, but we got him, father of trigger point acupuncture. So this is kind of the derivation of, this is the source of kinetic acupuncture, Dr. Choi, which again, on the notes, you'll see it in the notes. It doesn't come too clear on the screen, but this is my doctor I studied under, Dr. Hyung-Suk Choi. And then here is Dr. Shin from Jaseng Hospital. And then on the right side is Dr. Jonghwa Lee, the VST trigger point acupuncturist. The needle, we do muscle twitch response. So I just want to read to you this quote from Heo Im from the 17th century. And it's just in this little blurb, which right here. In case muscles of hand and feet were spasmodic and immobile, he inserted 4 to 5 round needles at the muscles and let others forcefully stretch crooked joint and flex stiffened joint. Okay, this is trigger point acupuncture in the 17th century. Korea. So there's a few books. I have my book here, Korean Kinetic Acupuncture. I regret I do not have a copy of Dr. Choi's book on kinetic acupuncture, but you can find that on Amazon. And if you have any questions, you can ask me about where to get this book from him on Amazon. A lot of what we're going to be talking about is in this book, some of the diagrams and the Piriformis technique. So we're going to go through this. Okay, before we start, I want to introduce you to what I named Choi's progression analysis chart. This is Dr. Choi, and this is a prognosis chart for pain. Now, these techniques are for pain. I do PTSD, I do all kinds of internal things, but when a patient comes for pain, we're probably going to be doing these two Korean acupuncture, VST or kinetic. Now, for muscle-related pain, I want to show this chart. There's the intensity of pain. Is it getting worse or is it getting better? How long have they had the pain for? So chart A, the intensity of pain, it's getting better. The pain is getting better, and this is the longer, the shorter duration. They've only had this pain for a short period of time, and the pain is already getting better. This is the most favorable prognosis. This is going to be a muscle sprain or strain, which is generally a 3 to 6 week recovery process without any intervention. So this is very interesting. We're making a prognosis. Now with these techniques, you know, when a patient comes and, you know, tells me what's going on, I make it a challenge. I'm going to say, I think we'll get you better today. Before I even start the treatment, we're going to do our best to get you better today, because that's our expectation. And so this is most favorable prognosis. The B, chronic pain, but it's getting better. So that's also favorable. You know, as long as it's getting better, you know, on a slow progression, that's favorable. You know, it may be a slow progression. Maybe we can speed things up, but this is in the chronic category, chronic back pain, but it's getting better. So yeah, we can probably even get a good result here on the first treatment. C is kind of like getting worse, just happened. This is like a recent episode and it's getting worse. So this one's like, okay, we have to really kind of do an examination. What's going on here? Is it a sprain? Is it something else? You know, so this one is actually the most questionable. And well, with the examination, you may be able to determine it's going to be a sprain or something. But chronic D, this one is the tough. This one is the chronic and it's getting worse. So this one, you know, for years, there's a medical history of surgeries and I don't know where this came from. Well, were you exposed to cold air conditioning? Like here in Florida, I say we self-expose ourselves to cold. Supermarkets, restaurants, air conditioning drafts. I think I make my patients sometimes feel guilty, and sometimes they may know ahead. What's the temperature you keep on the air conditioner? At 74, I start to go, ooh. At 70, oh no, that's not good. And of course, it can be a vicious cycle. It's always interesting too. A married couple, there's always like the battle of the thermostat. One spouse wants it cold and one wants it hot. It's like very funny and very common. And usually the person that wants it warm is on the short end of that stick. So and at night, like air conditioning at night. So some general precautions about cold. Number one, if you do have cold hands and feet, we're more vulnerable to cold exposure in our body. Not, you know, with short muscle, but not only that, I mean, we all know the stomach likes warmth. And so, you know, we want to avoid bringing cold to the stomach, but we can expose ourselves in the external air conditioning drafts, walking barefoot on a cold floor. Down in Florida, I think we underdress in the winter. You know, I see people in their 80s and it's like 50 degrees out in the winter in the morning and they're in the shorts, sandals, no socks. I'm like, would you be dressing this way in 50 degrees up north? No, you know, maybe it's going to warm up in the afternoon, but at that moment, you know, we're exposing ourselves to cold. So I like to, you know, especially if they have cold hands and feet, you can caution them about the cold. So ice. The use of ice, we consider ice will keep you in pain for a longer period of time. So almost always we're like, you know, and sometimes I'm like, people that have had pain for a long time, and I ask them, have you been using ice? And they're like, yeah, I use it I'm like, yes, because that's probably the reason why they have pain. So I get a little more excited, and I think we can help them. Just say, and it's always great to say, no more ice, no more, we don't like it. And they're like, what, really? Oh my gosh. So we like warmth. Now, what we want to do with our acupuncture is to go into those knots in the muscle, to untie the knots out of the muscle, to relax the muscle, lengthen the muscle, and stretch the muscle. The theme of our treatment is stretching with warmth and acupuncture. So there's one other thing on these 8 mechanisms, and that is peripheral nerve impingement. The short muscle or stretch tendon can impinge on the nerve at the periphery. It's not coming from the spine. It's coming from a short muscle or stretch tendon. So this is actually pretty interesting, pretty great stuff, especially like people that get numbness going down the hands and arms, and maybe they got a little neck pain and they've been to the doctors, and I think it's getting a little better, but maybe in the old days, if you go in with numbness and tingling in the hand and you say, I got a little neck pain, they start looking at the neck and saying, oh, there's probably a disc problem, which they're going to find a disc problem. 30 to 70% of the population has some form of disc problem. Degenerative disc, stenosis, there can be mild, moderate, so maybe some form of stenosis, arthritis. The spine is a very resilient structure, so we can have these, I call them normal abnormalities. We can have these problems with the spine, but actually have no pain, no symptoms, no nothing. So out of sight, out of mind. But yeah, like, you know, if somebody goes, I got some numbness down my arm, and they do an MRI of the neck and there's like a disc problem, they're going to be like, oh, well, maybe you need surgery. It's like, what? Well, let's consider that. So I'll give an example of like what we do when somebody comes in with numbness and tingling down the arm. Like a lot of times the peripheral nerve impingement is coming from the forearm here or here. And we just do a simple stretch. I'm not going to be very detailed about it, but if anybody wants to. And then I just have them do this. Keep the elbows straight, push down here, and then lift up on the fingers. And they should feel a pretty big stretch here. And then actually while they're putting the muscle in a stretch, I do a manual stretch and pull on the muscle while it's in a stretch. We do this as a set of 2 to 3 times. That's for the medial forearm. For the lateral, elbow straight, go like this with the hand, pull up on the fingers, and then you're going to kind of push down here as you pull up, and you should feel a pretty good stretch here. And then I may press with my fingers down on the muscle. So I do a set of 2 to 3, and then I say, okay, do you have numbness and tingling in the fingers now? And no, it's gone. Oh, that's great. That's wonderful, because that means the problem is only here, and we can rule out a neck problem. So as far as stretching and a diagnostic tool and exercise, it's wonderful. It can actually provide like a really good big relief. And well, we just showed them the stretch. They can do these stretches anytime, and they can get themselves out of trouble. So that's a kind of example. Muscle tendon pathology is generally very favorable. I mean, if you figure out a way to stretch, you can probably get good relief. Sometimes on these radiating things going from the back of the shoulder, there can be some tricky stuff like radiating going down the back of the arm to the fingers. Sometimes I find like a teres minor or teres major muscle or triceps. So I just have them do this stretch against the wall. And you're not going to get that on film, did you? So we'll go over that. But Piriformis Syndrome. Okay, so there's 2 types of sciatic. Okay. Okay, I'm just going to go right into here, and then we'll go back. Okay, so we're going to go just jump ahead there. There's 2 types of sciatic, in my opinion. The first is from a spine, a disc problem, where there is a disc, it's pressing on the nerve. Typically, I think this pain may kind of track down the lateral side of the leg, and it goes down to the foot. This type of pain, I think, is more constant, and there's no positional relief. It's like sitting, standing, sleeping. They don't get relief. I think a lot of young people get this. The acute bulging disc in a young person, actually, in my opinion, is maybe the toughest type to treat. The young people fall into that Sarno category, because the young people, they go out and they have new responsibilities, and they may have that psychological conflict going on, this is Dr. John Sarner's first book, triggering this back pain. So, and you know, they're young, but they get hit with this back pain. It's very discouraging, and they may have a lot of pressure, psychological. So they can be very difficult. But we have ways to help them. Older people, when an older person comes in with sciatica, they're going to have disc problems. Like I said, 30 to 70% does, but it's not that tough of a case. Actually, I think they're easier to treat, even if they come in with this here. Except generally, they may not have the full-fledged sciatic coming from here. Generally, with the elderly people, they're going to be hit. You're going to see a lot of this with piriformis. So just again, this is type 1 sciatic. A bulging disc goes down the leg. This is like more severe, like very severe pain on the spine, constant. There's no positional relief. And piriformis is number 2. And piriformis is a peripheral nerve impingement. And so as the sciatic nerve, it travels south, and it passes through the lower buttocks here, which is the piriformis is located right here, attaches to the sacrum, to the medial side of the hip. As the sciatic nerve passes here, this piriformis may be tight and short, and it pinches on the nerve here, and they're going to have a tract of pain that goes down the back of the leg, and then it can go to the front of the foot or the ankle. But this is kind of a telltale sign, I think, that differentiates from the number one to it goes down the back of the leg. Okay, they come in with that. Okay, I'm already starting to get excited. We're going to get them a good result. But also, this can be positional relief. This may be kind of an on and off again nature. They may get positional relief. Sometimes standing and walking can help them a lot. Maybe sitting is more comfortable, and generally they may not have any pain while they're sleeping. So that's kind of how you can distinguish piriformis from the bulging disc type of sciatic. Now, also people that have done long road trips, the snowbirds, truckers, drivers, they may get hit with this a lot. And so you can ask that in your intake. Oh, did you do a road trip before this happened? Did you just come down here and then, oh yeah, okay, it's gonna be probably this. And maybe they're sitting in like a high bar stool at home or something and the chair's just pinching on the back there. So those can be the piriformis sciatica. And then we're gonna go back up. Let's see here. Okay, now we're just gonna go just some kind of exam range of motion. This is external range of motion of the hip. In this position, the piriformis is contracted. External range of motion, the piriformis is contracted here. Now, I use the frog as kind of an example of a contracted piriformis. And, you know, I'm not a good artist, so forgive me. But the frog, they sit with their legs out like this. Their piriformis is contracted there. His hips are externally rotated. His piriformis is contracted. So in order to stretch my piriformis, I will have to do the opposite of this, which is to internally rotate my hips. This is internal rotation of the hip right here. Face down, the leg is just outwards. And this is actually, I don't have it on the notes here, but actually this position is actually a kinetic position that we can do in this position, and we'll demonstrate. So we're going to be, while the needle's in there, now when I do the acupuncture, I'm just basically doing the UB channel. I'm doing a general broad-based back treatment, but I'm also going to be going on the glutes and then specifically to the piriformis right here in the lower buttock area. So in that position, in the face down with the needles in place, I internally rotate the hip. So as the hip is internally rotated, the piriformis is stretched, okay? Now, this is kinetic technique. We put the muscle in a stretch, and then we're going to have them contract the muscle against resistance. It's isometric stretching. So as in this position, I internally rotate the hip, and then with my hand, I have them just push the leg inwards to the center against my resistance. And so you can sometimes see the piriformis like contracting to move the hip, but you're not letting it because you're resisting. So that muscle's in a stretch. It's contracting to move the leg, but you're not letting it. So the only option is it stretches, isometric stretch. So that's number one. Then we're going to go into the more, which I like, it's kind of it's like I like this, I love doing the second piriformis, which we're going to demonstrate. It's just like, the piriformis can be like a piece, I think of it as like a piece of saltwater taffy. It's like very thin and sticky and short. And this can be like, if the person doesn't know how to stretch, this is going to remain that way for long periods of time. So when we do the acupuncture in there, it's like really moist, nourishing the muscle. It's like untying the knots, it's bringing blood, it's making the muscle more plump and tender. So I don't know, I just like that imagery of being a saltwater taffy, and we're going to go in there and plump it up. This is the general kind of location, you know. I try not to, I just don't want to copyright any, I mean, I don't want to use any copyrights in books. Just pulling stuff from, what is this, Venice, the statue of David. Piriformis, generally in this area, it attaches at the sacrum, and then it goes on the medial side of the hip here. And so we can just kind of I call it carpet bombing. Sometimes I will use a nuclear bomb to kill a chicken to get results. So we do sometimes we do a lot of acupuncture down here. And then we do the movement exercise. Okay, good. Okay, now I just want to just show you this treatment plan triangle. This is a kinetic acupuncture. It's the treatment plan triangle. So with kinetic acupuncture, we may work down the muscle chain piece by piece. And so there's kind of we'll start with one thing first and then move to the second and the third and the fourth if necessary. So with this, we do just generalized lower back treatment to start with. And then this is a therapeutic lumbar technique. This is a Twina type of manual back stretch, which I can demonstrate. And then I do this is kind of my general, actually this is more like a general lower back treatment, and then we have some specific piriformis. But the order would be just kind of general passive localized acupuncture face down, the ashi points, trigger points. And then we can do, then I do a lumbar stretch. And then this one here, I don't think we'll have time to demonstrate, but this is a decompression stretch where we basically just teach our patients to hang from a pull-up bar or chin-up bar, let the back drop. And we have a tool in our clinic with a swimming noodle and a pull-up bar that we can do a decompression stretch with our patients in the clinic with 3 pieces of simple equipment. Very, very good. That's kind of like actually the take home for any kind of back pain is decompression. If you can teach your back patients just to hang from a pull-up bar or tree branch or jungle gym set. And there's just a couple techniques. We're not going to go into detail here, but we can do a psoas muscle stretch or generalized decompression. And that would be the last thing we do. After the acupuncture, it's like the icing on the cake. This is like the picture when I showed you earlier, with us lifting the patient and walking around the clinic, we're doing a decompression type of stretch. And we do it with acupuncture. When I moved to Cape Coral, I came from Los Angeles where me and another assistant would lift, and then I came here, I said, I'm not doing that. So I came up with a swimming noodle, a piece of rope, and a pull-up bar, and we just put the noodle under their shoulders, and then they just sit and drop, and then I can even do acupuncture while they're doing that. So that's actually the icing on the cake of the treatment, and it's a good take-home stretch for them to take home and keep their back in good health. Okay, so this is like the heart of the Piriformis kinetic technique. This position here, that's my wife, and we may be doing another demonstration just like this. Piriformis area is located here. So this would be step number 2, maybe, or 3 in that treatment plan triangle. After we did the passive acupuncture, they were lying face down. Then we eventually go into this face-up position. This is the common piriformis stretch that you'll find online. If you Google search, you're going to find this one. And we add one variation to this stretch, which is an isometric stretch. And then we do the acupuncture in this position right here. And when you do it, the patient will point. You can have the patient, where's that stiffness? Where's that tightness? And they'll point, and then you put a needle there, and you do this stretch, which we will do today. So here's another. Third picture of that technique, and we're going to be doing, they're going to be doing an isometric push against your arm here. They're going to push the knee up, but you're going to resist that. The piriformis is stretched in this position. As they push the knee up against your resistance, that muscle's contracting, but you're not letting the leg move. So the only option down there is the piriformis is going to stretch. And we do about a half chun insertion, which is fairly deep in this position. And it's interesting, like the patients miss them. They don't even feel the needles. And often they'll feel the muscle just stretch out like very quickly on insertion of the needles. And then you're in good shape. You're going to get a good result. So I think I kind of have it kind of detailed as much as I could where I kind of explain this, but we're going to demonstrate this. So I think at this point, yeah.
When you do this, do you do any manipulation of the needles as far as like a sedating technique to relax the muscle?
Nope. 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 So I just want to show using my wife just, and then we're going to do an actual treatment. So can you come up here, please? And we're going till 12 o'clock. We're probably going to finish pretty early here, so I may talk about other stuff, but okay. Okay, so you can lie on your back. Does everybody know or is familiar with that piriformis stretch? Yeah. Good. Okay. So, and this is, okay, so just we'll do the right side here. And you just cross the legs. I don't even really bother. Like to do it yourself, they say grab around and bring this leg up. But honestly, I don't even bother with this. You can relax. We'll put the needles right in. Actually, let's do this side. We'll put the needles, the patient will point where the tightness is. It's usually around here. And then I just bring the leg up. I've inserted the needles. And then we stretch as much as they're comfortable with. And then from this position, I coach them. I ask, can you push your leg outwards in that direction? But I'm going to resist. 1, 2, 3, 4, relax, and return, relax, and return to stretch. Okay, and then we're going to repeat this 10, maybe upwards of 10 times. Go ahead and push. 1, 2, 3, 4, relax, return to stretch. So what we're doing is we're stretching this down here, and then push that. Go ahead and push. That muscle is contracting to move the knee outwards, but we're not letting it move. So the only option is this muscle stretches here. So that's the piriformis technique. You ready for a demonstration? Okay, good. Okay, so okay, so let me just get a little understanding of, you can take a string, lap one another. So if there's a tightness in one, there may be a tightness in the hamstring, so maybe there's some hamstring stretches to do. Do you easily get cold hands and feet when the weather turns cold? No, okay. How long have you had this pain?
Since 2008.
Okay. Is it severe? On a scale 1 to 10, 10 being the worst?
It's like a constant 3.
Constant 3. Does it fluctuate on and off at all, like getting worse at any point? Or?
Sometimes it can get into a sharp and stabbing.
Do you know when that happens?
If I do a lot of sitting.
Sitting. Okay.
Yeah.
Do you drive road trips?
No, but I work on one of these terrible stools in the office.
So there you go. That may be it. Sitting is the culprit. Do you have any pain along the spine here?
Down on this side.
Maybe a little bit there, but primarily it's on the left hip there. Okay, that's good. Yeah, so we probably won't do a back treatment. Okay, so, and is there positional relief? Do you sleep okay?
I rotate from side to side and I turn off.
Because of the discomfort there? Okay, good. Okay, what's the air conditioning temperature you keep in the house?
8.
Oh, that's good. Good job.
Oh, God.
Okay, so yeah, no cold exposures that may also correspond to that chart. It's just that seat. Okay, and you're not barefoot when you're sitting on the seat, so on the cold floor. Okay, very good. Okay, so this should be pretty favorable. It's not like a sharp, super severe pain, and it's kind of dull, not terrible, and it's kind of localized to the piriformis area.
Well, for example, at the moment, it's a burning pain.
Burning pain. Okay. Okay. So yeah, what I'd like to do is I want to do a two-part treatment, like face down, and then we'll do that technique face up. So we don't have a face cradle, do we?
There's one underneath the table.
Oh, is there? Okay, great. Okay, so I'm just going to ask if you can loosen the pant. Now, these pant legs, I don't know if, okay, I think we can get them to roll up. We may be able to, we may have to loosen the pants one way or another. Okay, and we have some towels we can cover you. But to start with, I want to have you lie face down and just, is that going to be okay there?
That's just in case.
And are your pants loose?
Yeah.
Okay, good. Okay, so I'm going to lower the pants here. And then I want to make sure you're going to be comfortable. So we are going to put something under the feet. Okay, there we go. Okay. This is the best we're coming up with. And then, sorry. Can I lower the pants here to that area? Okay. Can you point for me again where that pain is or that tightness? Yeah, that's it. Perfect. Okay, thank you. Alrighty. So we are going to do kind of a generalized acupuncture here in the passive position, and then we'll do the kinetic technique number 1. Now, with a general back, he does have some back pain over here, but I'm not going to do it today. But generally, we're talking about the points on the UB channel here, kind of like your standard lower back treatment, I suppose, in the face down position, UB channel. But then we can go off the acupuncture points, the upper glutes here along the pelvis. But we're going to do just local along here. Okay. Now, the muscle jump and twitch. If we do a neck treatment, like we can almost predict that the muscle's going to jump and twitch. Have y'all heard of the muscle twitch response? You're pretty familiar with that. So that's like the muscle when it does it. I just say it's untying itself in the knots, it's relaxing itself, it's stretching. Very good response. The problem is it can be very painful. So we have to balance the patient's comfort level with the technique. I mean, sometimes it's too, not infrequently, it's overwhelming pain for the patient. So then we just have to ease off, and we'll just do a traditional IQ without the pushing and probing of the needle. There may be soreness after the treatment. It may feel like you're lifting weights or working out. There may, we may get some, again with the neck, it's almost like you can almost predict it, that it'll happen. But sometimes we get it down here with the piriformis, and you just kind of push and probe. There's a little bit there. Was that a twitch?
Yeah.
Yeah.
Wow.
So we're getting the twitch. You can even see it. Some of you may see that, right?
Oh, you're not even using a big needle.
Yeah, we're using a 2-chung needle here.
Wow.
We're going very deep. The thickest part of the muscle is in the gluteus. So we can go very deep here with these. Very good.
What thickness are you using?
This is probably a 36.
25, 0.25.
The gauge, maybe like 36. Sometimes we don't get the muscle twitch. It's not, I don't get it all the time down here, but you kind of search for it. And this is the general area. Wonderful. Are you pretty comfortable?
Yep.
Okay, now in this position, I forgot to ask, do you have the burning pain right now in this position?
Nope.
Yeah. Generally with piriformis, the face down position may provide positional relief. So even before you do the treatment, they may not have any back pain, and already you're like, great, piriformis. We should be able to get you better. So very favorable. And like I said, I will use a nuclear bomb to kill a chicken. Has anybody ever heard that phrase? It's kind of funny.
Yeah, it's ironic. Doesn't take much.
Yeah. Doesn't take that much to kill a chicken. But if you have to use a nuclear bomb, you're really going to kill that chicken.
Would you ever use the kinetic technique, like where you needle the opposite glute? Like, would you ever kind of get?
This is kind of, yeah, you can.
we can get creative, like the tan techniques, but this is pretty straightforward, just going after the muscle and going on the muscle here. So I think we're almost done here. Are you okay?
Yeah, that was about.
Oh, okay.
Yeah.
Let me know if it hurts. If it continues to hurt, I'll take it out. Okay, so we kind of covered the piriformis muscle here. Now, we're going to go into this kinetic technique. If there's any discomfort that you have, now I'm going to bring your leg outwards like this. Are you okay?
So far.
So far? Okay. Now, we want to be very cautious with the hip. We're not going to force or push with force. We're going to go to the patient's level, but we may, as we do this, get more range of motion slowly. Are you okay? What I'm going to ask you to do is I want you to push your leg to the inside like this, but I'm going to be resisting against your movement. So can you push your leg inside? 1, 2, 3, 4, relax. Are you okay?
Yeah.
Now keep an eye, you'll see this contract. Go ahead and push. There it is. 1, 2, 3, 4, relax. Can you feel that muscle down here contracting?
Yeah.
Does that feel like that's the source of your pain, where everything's coming from?
Pretty much, yeah.
Okay, wonderful. Can you go ahead and push again, please? 1, 2, 3, 4, relax. Okay, so we may get a little more range of motion. Try to relax, relax, relax. Oh, okay, relax. Okay, go ahead and push again. 1, 2, 3, 4, relax. Okay, one more time. Go ahead and push. 3. Now, you know, often the patient may have the radiating pain or numbness in the feet during this part of the treatment, but sometimes after doing this, ask, do you have, well, you didn't have any numbness going down the foot, right?
No.
No. Okay, but ask, do you still have numbness? Did it go away? Maybe it goes away, and you're hitting all the right marks. Okay, at this point, we would just go about 20 minutes like this. Did you want to relax for a few minutes?
Okay.
Okay, and at this point, we'll go about 5 minutes. And if anybody has any questions, I can come out there. And well, does it feel pretty good? Are you able to relax?
Oh, what's interesting is everything is more localized. There's, yeah, not the awareness on the posterior leg.
Yeah, like going down the leg.
Yeah.
Yeah, that's good. Okay, so we just go about 5 minutes. Does anybody have any questions at all? Okay, Nani, I'm going to stand right here. So, okay, now we're going to go into this Piriformis number 2, and I just love doing this. Okay, thank you so much for volunteering here. Okay, are you okay?
Yeah.
Okay, I'm going to cross your leg over here. Now we're just going to demonstrate first. A lot of times I'm not just doing the needles. I'm going to do the stretch, and if they don't need the needles, I'm not going to do them. So we're going to do the stretch first without the needles. I'm going to bring to your chest. Now, if there is any discomfort, let me know. Are you okay?
Yep.
Okay, so do you feel any kind of tightness down here?
Oh, yeah.
Yeah, okay. So I'm going to ask you to push your knee in that direction, but I'm going to resist.
Okay.
Going to push. 1, 2, 3, 4, relax. Are you okay?
Yep.
Okay, now I kind of challenge a little more. Going to push again, please. 1, 2, 3, 4. Can you feel that muscle down here?
Oh, okay.
Yeah, you can feel it stretching out, right? Okay. Go ahead and push again. 3, 4. Okay, now we are going to do needles here. Are you okay with that?
Yep.
So just keep this position here. Can you point where you feel that tightness at?
It's coming
Right.
right, yeah,
Okay.
right along here.
Okay, you ready?
Yep.
Thank you. Everybody can give a hand to my wife. She's such a great assistant.
You're gonna need the treatment yourself after this.
Yeah.
It's I call it a short person's world.
Anything against it?
No, except when you have back
I'm
pain
joking.
and you have to use the restroom.
I'm teasing you. No.
That comes into psoas muscle when I say short person's world, because you're always tightening up the psoas muscle. I know, I'm joking too.
I'm a midget. Did you see my height?
Yep.
Okay, so we're going about actually 3/4 in, and you can probably, do you feel the needles? Not too bad?
No.
Okay, so we may do about 4 or 5. Try to get there, just along where he pointed at. Okay, and then we're just going to do the stretch again.
Yep.
Okay, let's go ahead. Now, okay, how does it feel?
A little different.
Yeah. Are you okay?
Yeah.
Is it painful?
No.
Does it feel any looser?
If you calmer, yeah.
Yeah. Go in and push. 1, 2, 3, 4. Relax. We'll do this think we're getting a little bit of range of motion here. Go in and push. Are you okay?
Yep.
1, 2, 3, 4. Relax. Okay, 2 more. Okay. So we're going to do it again without the needles. Are you okay?
Yeah.
Let's just give you a little moment to stretch out here. Good. You okay there? Okay, let's repeat again. Okay. Are you okay?
Yeah.
How does that feel?
Much better.
Yeah. Go in and push. 1, 2, 3, 4. Okay. I want you to do this yourself now. Can you grab with both hands around the knee? Pull all the way to your chest. All the way as much as you're able and comfortable. Now push against the resistance of your own hand. To the side. 1. That's it right there. That's a little, you want to make sure they're pushing to the side. Sometimes they want to kind of push down and they may not want to, so just coach them to the side. And go all the way up as much as you're able and comfortable and then push to the side. Can you feel that muscle down there contracting? Okay. Now, this is the same position as if you're sitting in a chair cross-legged. So you can do this stretch sitting. You want to try it sitting? Okay, can you stand up please? Or sit up? Okay, let's just do it. Do you want to come around the front? Are you able to? Okay, I want you to just cross your left leg over your right knee. Okay, and then we're going to pull all the way up to the chest. Okay. Okay, now all the way up. Are you okay?
Yep.
Now can you push the knee in that direction against your own hand? 1, 2, 3, 4. Relax. Return back to stretch. Are you okay, Daniel?
Yep.
Go and push. Can you feel that?
Yeah.
Okay, relax. And go all the way up again. Okay, and push 1, 2. Okay, let's check. How do you feel? Can you stand up?
Yeah, definitely feels better.
Yeah.
Yeah, it's not burning.
So to maintain it, just remember this stretch. Now some patients, they forget the instructions and when they come back again, they're like, I was doing that stretch, I'm pushing down. No, they forget. You got to bring up to your chest and then push against the resistance of your own. So if you ever get that burning pain, or you can probably get rid of that sciatic by just doing that stretch. Yeah. But thank you so much. I think, do you have any questions on that?
No.
Thank you so much.